Hello, Sachin Patel here, Dr. Sachin Patel here, GP coach and mentor for doctors and dentists. Thanks for joining me today. Um, for those of you that know me, hello again, and those that don't, I'm Dr. Sachin Patel, as I just said, GP, but now I'm really mainly a coach and mentor for other doctors and for dentists. And I help doctors and dentists find more time, more income, and reduce stress. That's my targets. So today, what I'd like to do is respond to quite a lot of the queries that I've seen around on various internet sort of doctors forums or fora, and I hope, I know I can add great value to you with this information. And the information I'm going to share with you is really based on a combination of my own observations, my own experience, as well as professional coaching and mentoring that I've received from external sort of individuals and companies, and that I've paid quite a lot of money for over the years. I've probably spent about $150,000 on various sort of education, coaching and mentoring programs that I've received, and I've received great value for them. And so what I'm doing here is sharing some of that knowledge with you in the hope that you can apply it and find it useful and see some results from it. So in the last video that I did, I talked about the 5 sort of variables if you're looking to boost your revenue or boost your income. And just to refresh your memory, those 5 are the number of leads that you receive, the number of those leads that get converted, the number of transactions that you undertake, the average transaction value, and the margin, so profit margin. Now, if you remember from my last video, if you haven't seen it, you can hop on my Facebook page or YouTube and watch it. It's called Doctors Boost Your Income. But if you remember, what I said is margin is the last one really that you want to, that I recommend, both as having been a contractor and as a practice owner. It's probably the last one to look to try and modify. The rationale behind that is that trying to squeeze a practice in this sort of difficult climate is not. It could be counterproductive because if practices are squeezed on their income, they will need to modify their services accordingly. So what I'm going to just show to you today is how, by modifying 4 of those variables, you can actually bring about a compounding improvement effect. So if you were looking at your leads, for example, your leads, your conversions, your number of transactions, and your average transaction value, if you improved each of those 5%, you would not get a 20% improvement in your revenue. Actually, what you would find is that if you improved each of those 5%, you'd get a 21.6% improvement. And that's due to compounding. So it's a 5% improvement upon another 5% improvement, upon another 5% improvement, upon another 5% improvement. Similarly, if it was a 7% improvement in each of those 4 areas, instead of 28% improvement, you'd get a 31.6% improvement. So significantly higher than the individual components. And that's purely because of compounding. So the reason that's important is that it's actually very easy to get, up to a 10% improvement in any one area. And so if you can spread that improvement across those 4 areas, you're really likely to see a really significant improvement in your revenue and hence your income. So if we sort of move forward a little, that compounding growth principle is one that will carry with us. So now what I'm going to do is just break down those 4 areas just to give you a bit more explanation. Now this applies whether you're an individual GP working as a contractor, an individual dentist working as a contractor, an individual specialist, or even if you're a practice owner. It's just a case of looking at what I'm describing to you in a slightly different way. So what I found over being a contractor and as a practice owner is that the ideal optimum level is really to aim at about 90% appointment capacity. The reason for that is that those few spare appointments just give you a bit of breathing space, so that if you have the opportunity to do some extra work with a patient, you've got that, and you're not restricted by excessively strict time schedules. So when we're talking about the number of leads, increasing those, let's talk about those. So a simple way to increase your number of leads is by referral. So and those referrals could come from a variety of sources. If it interests you and you'd like to know more about it, I'll do another video just about how you can increase your number of leads or number of patients. So yeah, referrals is a simple way. Another simple way is advertising. So everyone knows flyers, newspaper adverts, etc. Personally, I could spend a whole hour or two on that subject, or perhaps a day. I'll tell you and share with you that from the results that I found, advertising is probably at the bottom of the list of ways to increase number of patients. So, and ironically, it's the most expensive. So, like I said, I'll do another video about that in the coming sort of days or weeks, and we can share that and look into that together. So that's leads. Conversions is the number of people that contact the practice looking for an appointment, or perhaps needing an appointment. How do we increase those and get them booked in? Well, it's about having mechanisms so that we can capture those. So for example, someone who's been before or in the last few days, you want to be able to identify those and not turn them away. Even if you're full, there's probably a way to find space for them. And if you can harness those and avoid them going elsewhere, it means that you're increasing your conversion percentage. The other thing is finding out if someone does inquire and then decides not to book, why is that? Is it related to your availability? Is it related to the time? Is it related to cost? Is it something else? Once you have that information, then you can find ways to counter those and thereby increase your conversion rate. Number of transactions. So similarly, this is another one where it's about increasing return rate. So that's not about calling people back unnecessarily. What it means is it's about retention. So the more you can retain people and have mechanisms that even when you're busy they can access you, then that allows you to just boost up your transaction rate. So the average, for example, in Australia, the average patient visits their GP 6 times a year. Now, if you find when you calculate your return rate, or your average number of transactions per patient, or average number of appointments per patient, and that's sitting at 2 or 3, then it means most likely some of your patients are going elsewhere at other times. Now that might be for a variety of reasons, but it would be pretty useful to know that information, because there may be and there will be things that you can change there and modify about your internal systems, either as a business or as a personal individual doctor, in order to harness some of those, so that hard work you've done to sort of capture those patients does not go to waste. And then finally, average transaction value. Well, again, there's a whole variety of ways to improve those. If you're watching this in Australia, we work on a fee-for-service system that is supported by the government heavily, called Medicare. Other places in the world working on a fee-for-service system will be working in different funding models, but the premise is the same. There are ways within sort of your medical billing that you can add value, number one, and really add value to the patient, and do more for them, and alongside that you are able to charge for that. So when you can add value and it's something that the patient's health will benefit from, or something that they want, such as a cosmetic procedure, if you have the skills or the knowledge to provide those, then that will ultimately drive up your transaction value. And so when you combine the effects of changes in those 4 areas, that's when you get the compounding effect that brings about a significant boost to either the revenue of yourself as an individual practitioner or to the business as a whole, if you're a practice owner. So I've given you a bit of a whistle-stop tour there and shown you how compounding benefits of changes in each of those 4 areas that I've mentioned makes a sort of disproportionately larger improvement in your revenue. The next thing would really be to break down each of those areas one by one so that we can really dive in and find ways to really sort of add depth to what I'm telling you. I'm trying not to overload you, and so giving you small bite-sized pieces that hopefully you can start to assimilate, start to look at how you can apply some of the concepts I'm talking about, and add them to your personal or your personal list or your personal contracting income or to your practice. So I think then the next video, if you like this sort of content and you're finding it useful, I'd really like you to sort of either tick a like or type a yes down below, because that helps guide me as to the type of things that you find useful. I'm just going on responding to what I see as common questions from my clients and also from the various fora on the internet that I'm part of. And so I hope I answer your questions and your queries in that way, and you find great value from what I'm telling you and can go and apply it. So yeah, the next thing I'd like to do, if you're keen, is really dive into how you can sort of increase your number of patients, often without spending anything or very small amounts of money compared to traditional advertising methods. Excellent. So once again, I'm Dr. Sachin Patel, coach and mentor. Thank you for spending your time with me, and I hope you've again found great value in this. I'll be back soon with my next video, and in the meantime, have a wonderful day wherever you are today, and take care of yourself in between. Thank you. Bye.